And is this a non-infectious fever? That is what was our question. So with the gradually falling hemoglobin, though the peripheral smear did not show blast, we did a bone marrow. We picked up the acute leukemia in this child, and the child is doing well. And bone marrow confirmed leukemia. What we learned was that any PUO, you should not forget leukemia as an important cause. Imagine if somebody had diagnosed this as rheumatoid arthritis or some other arthritis and started steroids without ruling out lymphoreticular malignancies, it would have been disastrous. Because one of the take-home points in such cases, in addition to doing blood work, count, smear, etc., smears may not show. You have to do uric acid and LDH, which may give clues to malignancy. And of course, never give steroids without doing a bone marrow. That is what we learned in this case. Case number 2. This was a 10-month-old infant who had fever and irritability for 10 days, continuous fever. The parents had noticed that the right jaw was swollen for about a week. Child was admitted in Hyderabad in a hospital, given ceftriaxone and clindamycin, thinking it would be osteomyelitis. Counts were 13,000, platelets are normal, CRP is 48, alkaline phosphorus is 1,000, it is elevated, but vitamin D levels are okay, phosphorus is okay, cultures are negative, advised bone marrow, they flew from Hyderabad to Chennai. On examination, the child was otherwise well except for tenderness and swelling over both sides of the mandible. This is the picture of the infant. You can make out the nice swelling in the right side of the jaw here. The mandible is swollen. The baby was alert, otherwise well. And an X-ray was taken. This is the X-ray finding. Of course, any postgraduate can make out. It's almost like a necklace appearance of the mandible, suggesting the possibility of cortical hyperostosis. And the radiologist clearly said it is Caffey's disease. A clinical diagnosis was made and it resolved with naproxen. Of course, genetic diagnosis is an autosomal dominant disorder. Nowadays, you have genomic workup facilities available. We confirm the child is well on follow-up. It's now an adolescent and doing extremely well. So, actually, but for the diagnosis of Caffey's disease, we would have gone in for invasive things like bone marrow and even a biopsy of the lesion to rule out malignancy. Ultimately, it turned out to be Caffey's disease. Caffey's disease is notorious for presenting like malignancies. But I have seen Caffey's disease involving tibia, involving clavicle, involving fibula, involving radius. Any bones multiple bones also can be involved. There's typically a radiological diagnosis. ESR and CRP are high, and alkaline phosphorus is notoriously high. And it's a clinical diagnosis. It's basically a clinical diagnosis along with radiological confirmation. Because genetic confirmation is nowadays available. Treatment is self-limiting. You don't have to give steroids. You can give ibuprofen or naproxen for a short period.